are my flashcards? This one. What they're doing is they're making the decisions for us. That's what this country is coming to. They're going to make the decisions for us. This is a quote that we're looking at by Michael Schiavo. Now, some of you may or may not have heard of him, but he was involved around this type of controversy around the start of the century, and ultimately it was involving his wife, Terry Schiavo, and a really tragic misfortune that happened while they were still married and she was still here. Well, little did anyone realize the years of sorrow and pain and desperation that this man had to go through just to say those words, just to get us where we are today, okay? So, to explain the situation, in February of 1990, Terry Schiavo, his wife, of 26 years old, she had an immense problem with this eating disorder, which ultimately led to her having an episode of cardiac arrest in her residence in St. Petersburg, Florida. So, after everything transpires, she is successfully resuscitated. However, even though resuscitation worked on her, it still left her quite damaged afterwards. She had such a lack of oxygen. And not only that, but it had gotten to her brain so horribly, so massively. She had such injuries to her brain that doctors later on diagnosed her with PVS, which PVS is persistent vegetative state. That means that while she may be awake and her body is functioning, there is no cognitive functioning, there's no brain functioning to where she is aware of what is going on. So at that point, we ask, what is her quality of life? What kind of life is she living? Okay, so the problem we see here is that Terry's only 26. She does not sit back and think that she needs to make a will already, you know? So she did not have one at the time that this transpired, which led to huge challenges and problems between her husband, Michael Schiavo, and her parents. And they both conflicted back and forth because her husband knew ultimately what she wanted. He said him and Terry talked all the time because ultimately if she was in a scenario like that, she wouldn't have wanted to suffer. However, her parents, on the other hand, step back and they're like, hey, no, they're like, we want our daughter alive. We want her to be kept on feedings. We want her to still be going. We want her to live. They want that hope, you know, that she might pull through this. However, every treatment, every center, every place they went was not giving them that hope. And ultimately it led into a court case that went on for about 7 years. So this leads me into the topic that I'm going to talk to you guys about today, which is the topic of assisted suicide, or as we sometimes know it, euthanasia. And ultimately, it is a very controversial topic because there are pros and cons that are seen from each side, and I am here to discuss why we should make it an option in more states within the United States, because ultimately the option is not saying that you have to go with it. However, it is something that needs to be implemented in the United States. So from that, I will also say that personally, I have discussed and researched this topic many of times as well, because I have many close people to me that have been in their end of life stage and or are classified as terminally ill, and they beg, they plead that if they were ever in as much pain as they were, that please don't let me suffer. So I bring this up to mention that people are going through tough times as patients, and we need to take into account both sides, not just what a specific group of people want. Okay? So in starting this, let's go ahead and look and characterize at what terminal illness is. So according to the website of Marie Curie 2019, terminal illness is a disease or condition which cannot be cured and is likely to lead to someone's death. Okay? So this is very much true and concerns all of that. And typically, when we look at it, terminal illness can also be diagnosed by doctors, and they'll be like, hey, you have about 6 months to live. Those are typically, I would say, the most seen cases. Now, in the case of Terry, she had PBS, and again, as I mentioned earlier, wakefulness but no cognitive functioning. So again, the question, like I said earlier, what is her quality of life? What kind of life is she living? Would that be what she wants? So, taking from that, I would also like to go ahead and define and characterize what assisted suicide is, or euthanasia. Looking at this, Medical News Today, 2018, euthanasia and PAS, which is physician-assisted suicide, refers to deliberate action taken with the intention of ending a life in order to relieve persistent suffering. Okay? Keyword there, suffering. Okay, so another topic I want to bring up, there are different types of assisted suicide. There is active and there's passive. To put it in simplicity terms, active is lethally injecting to end someone's life, and passive would be to withhold some life-sustaining material or treatment or something from the person. So in the case of Terry Schiavo, it was her feedings. She would be withheld from her feedings. So ultimately, we're looking at this controversy, this huge back and forth between whether assisted suicide is really something that we should consider having more across the nation, or is it really that touchy of a topic? It's very similar to something like abortion in that manner. So when we look at Medical News Today, 2018, we see that there's a lot of hostility towards certain aspects and factors of assisted suicide. Those include the role of the doctor and them having to perform that on the patient. And then there's the moral and religious argument. Are we playing God by killing these people? Ending their life even though they're in this tremendous pain and suffering? So there's that. There's patient competence. We wonder, are the patients still there? Can they actually think and stuff? And while we're talking to them, even though they're in this state, and that's still just a gray area that we're looking at. Then there's guilt, mental illness, the question of, are they going to recover? it's really hard to say. You know, there are cases that have gone 10, 20 years and still recovered from a coma or something as, you know, tremendous as that. So ultimately, those are our questions that we raised there. Now, I'm here to argue on the more beneficial and pro side of assisted suicide. Now, this is because, again, personally I've experienced, and in the case of Terry Schiavo, her family and her loved ones have experienced that same exact thing of this person that you care so dearly about going through suffering, and you don't want that for them. That's the last thing you would ask for. So, you know, the benefits and the things we're looking at is you're giving the patient the freedom of choice, you know, their rights, their dignity, you know, their quality of life, because when they're suffering, that is no quality of life to be living. They don't want to be going through that pain. Another benefit, you know, is, again, humanity, your loved ones, and the grief that they will have to go through. You know, no one wants to go through that. No one does. And then there's the question of, you know, the grounds that it's already implemented in society. So to back that, we typically see, you know, animals, dogs, cats. If they're in pain, what do? I mean, if they're in that situation, we put them out of their suffering. I'm not saying at all that we compare ourselves to animals. However, we would do it for the animals that we love the most. Why would you not consider it for the people you love the most? So, when we look at Oncology Times 2006, while some of the change is attributed to the changing of America, the Schiavo story continues to motivate people to explore their end-of-life options, make decisions, and inform others of what those decisions are. So ultimately, this just goes to show that the Schiavo case was such a big role in getting us where we are today. And even where we are today is not where we want to be. So in the US right now, we have barely even a third of the United States that has approved for this assisted suicide option for patients. And to me, that is so disheartening, because ultimately, if it's a moral or a religious stop, and people, you know, they don't feel all right about it and stuff, that's the reason we make it an option. So with it being an option in the United States, in each state, you do not have to take it up, you know, that is your decision, your loved one's decision, but ultimately, I do feel like it needs to be implemented in more states than what we see it in. Like, I'm pretty sure the states are California, and we've got Hawaii, and New Mexico, and Colorado. So, ultimately, there's not many states that have implemented this or allowed it. And, again, touchy, controversial topic, however, we need to break that, part of us, because honestly, at the end of the day, we need that as an option for more people than it is at this time and moment. And I don't know about you, but ultimately, when I think about it, is I've had loved ones in those situations. In Terry Schiavo's case, do you think she wanted to suffer? Do you think her family wanted her to suffer? You know, ultimately, you never want your loved ones or the people around you to go through that at all. And my question is, put yourself in those people's shoes. You know, put yourself in that situation. What would you do? What would you choose? Thank you.